We have finally made it, everybody. We are on to our final unit of this semester, and it's a big one. It's going to be the nervous system, covering chapters 11, 12, 13, and 15. Fortunately, you have me, Dr. Snyder, here, your resident functional neurologist at Indian River State College, to help break it down for you. So let's dive right in. Starting off here with chapter 11, we're going to be talking about all of the different cells in the nervous system and how their physiology is going to operate. Just like we saw in the skeletal system and the muscular system, we do, of course, have our divisions that we need to talk about. And in the same way that we had the axial and appendicular divisions for the musculoskeletal system, we have multiple divisions in the nervous system as well. They're going to be our central nervous system, the peripheral nervous system, and then one of a recent discovery here known as the enteric nervous system. So the central nervous system, of course, is going to be the one that we find within our brain and our spinal cord. They're going to be encased by bone, and they're going to be responsible for most of the higher order processing in our nervous system, things like processing, coordination, and integration. When it comes to the peripheral nervous system, we are talking about all of the different nerves that are going to be found outside the brain and the spinal cord. So we're going to have two types of nerves in the peripheral nervous system. They are going to be the sensory nerves and the motor nerves. They are also known as the afferent and efferent nerves. The easy way to remember this, that our sensory nerves are the afferent nerves and the motor nerves are the efferent nerves, is to think that the motor nerves are going to be the ones carrying information that tells our body what to do or how to actually move. So these are the nerves that are making our body produce effort. They are the efferent effort nerves. Where the motor nerves are going to differ from the sensory nerves as well is in the direction for which the signals are going to travel. The motor division efferent nerves are going to have signals that travel down away from the brain and the spinal cord, whereas the sensory division nerves, the afferent division, those are going to be the nerves for which signals will actually travel up or ascend towards the brain and the spinal cord. So where the motor nerves are the ones giving the effort in the body, the sensory nerves are the ones with ascending signals to the brain. So remember those with afferent, ascending for sensory, and efferent, effort for motor. Further dividing the motor division of our peripheral nervous system, we have our somatic motor nerves and our autonomic motor nerves. The somatic motor division is going to involve our voluntary movement. So, what kind of tissue do you think of when you hear the word voluntary? The answer should be skeletal muscle. Skeletal muscle is going to be our tissue that moves on a voluntary basis. So all of our skeletal muscle, all of those motor nerves activating skeletal muscle, make up the somatic motor system. Whereas all of the motor nerves that drive our involuntary processes, things that operate our internal organs, as well as our parasympathetic and sympathetic activations, those are going to be considered part of the autonomic motor division. And then finally, with our enteric nervous system, this is going to be the one of recent discovery. Neurophysiologists recently noticed that the nervous system, the peripheral nervous system, which helps to activate our gastrointestinal function, actually functions slightly differently and a bit separately from the rest of our nervous system. It's part of what we call the gut-brain axis. So that's why we have recently classified this as its own division of the nervous system, the enteric nervous system. And this graph is going to give us a really clear picture of where we're going to find those sections of the nervous system. We have, of course, our central nervous system located up top and in the spinal cord. And then our peripheral nervous system is going to include all of the nerves that branch off and go throughout the periphery of the body. But let's take a look at this flow chart that we see through here. So when we have information that goes through the nervous system. Of course, the information is usually going to start with a stimulus. The stimulus is going to be found right down here. For instance, we can say the stimulus in this situation is stepping on a Lego. So we have a pain stimulus entering the foot, and it is going to be picked up by the receptors, the pain receptors that we talked about when we discovered the integumentary system this semester and talked about our different pain receptors such as the Pacinian corpuscles. And we're going to see this pain signal be caught by the receptors and then ascend up the afferent division of the peripheral nervous system, up those sensory nerves. That pain stimulus is then going to travel into the spinal cord and continue ascending up until it reaches the brain. Once it reaches the brain, we are going to see information processing occur. The brain is going to say, well, how should we react to this sort of situation? And there's going to be a couple of different parts to something like a pain stimulus like this. The first portion of information processing is going to come by way of the spinal cord through a reflex, allowing the body to quickly step off of that painful stimulus. But the brain is also going to process what else to do about that Lego left on the floor, for instance. So the brain is going to process this as, why is there a Lego on the ground? I just stepped on it. That sucked. What can I do to go ahead and remove that situation? So the brain is going to say, let's go ahead and activate the efferent division, the motor division of the peripheral nervous system, especially when it comes to the somatic nervous system. We're going to tell our skeletal muscles to voluntarily lean down, pick up that Lego, and put it away where we will no longer step on it and experience that painful stimulus again. What's also going to happen is that the brain, especially if this is something that's happened to you multiple times before and you go, oh my gosh, I'm really tired of stepping on this Lego, the brain is also going to activate your autonomic nervous system, especially the sympathetic division, because it's going to be rather irritating to have that painful stimulus happen again and again. And by activating that sympathetic division, it's actually going to really kind of make you feel a bit agitated. So you're going to end up seeing the cardiac muscle and the smooth muscle activate conversely here to help raise your blood pressure and increase your heart rate as a result of that frustration that you're feeling. That's the portion of the sympathetic division. And just to recap, though, when we talk about those autonomic nervous system activators, those are the ones that happen automatically. We do not have to actually consciously activate those portions of the nervous system. To give another example, let's talk about something like the process of eating. Say our stimuli instead is eating something delicious. So we just had Halloween a few weeks ago. So say you have your favorite Halloween treat is our new stimulus. And that stimulus is going to be picked up by our receptors. So we'll talk about our taste receptors in the mouth. That stimulus is going to be picked up by those taste receptors in the mouth, sending the signal up the ascending afferent division to the brain, where the brain is then going to process that as a delicious treat and going to do two things. The first is that it's going to stimulate the motor division of the peripheral nervous system and then begin to activate the autonomic nervous system on the parasympathetic side, because the parasympathetic side is also known as the rest and digest division of your autonomic nervous system. And since we're talking about eating, this is going to be where the digest portion of the parasympathetic will activate. Your body will then begin to secrete more saliva via the salivary glands in the mouth to help break down some of that candy as you eat it, and then stimulate peristalsis so that we can actually swallow our food. And peristalsis is our medical term describing the process of the body's esophagus moving food down the body to the stomach. And then, of course, We're also going to have the activation of our somatic nervous system, the voluntary motor system, because that treat is going to make us want more, right? So we're going to go ahead and reach for another one. Next, let's go ahead and cover the individual cells of the nervous system. So, of course, the main one that we want to discuss is going to be the neuron. The neuron is going to be the one that makes up most of the central and the peripheral nervous system because these are going to be the cells that are specialized for intercellular communication, meaning these are the cells that actually carry action potentials, the electrical impulses that our brain and body uses to send information. Now, neurons can come in a couple of different shapes. We have this one over here is going to be our classical shape that we see right here, where we have one single cell body, multiple numbers of dendrites, which when we go back to Unit 1, when we covered our four types of tissue, Unit 2 rather, our four main types of tissue, we talked about how dendrites are going to be the portions of the neuron that are responsible for receiving incoming information, incoming action potentials. They are going to pull all of those action potentials in to the cell body, where the cell body will then process that action potential and then propagate a new action potential at the axon hillock that we see down here, which is going to be this enlarged portion leading down to the axon. The axon is going to be the branch that will actually carry information away from the cell as it goes down to the axon terminals, and those axon terminals will then create that synaptic cleft or that synaptic gap that we talked about when we discussed those in the muscle unit. Now this form that we see right here is going to be our most common form of neuron in the nervous system. Now this is going to be that multipolar nerve that is going to be classified as multipolar because it has multiple different dendrites and one axon leading away from the cell body. So we have multiple points of contact on that cell body. This is going to be different from other types of neuron structures that we would consider something like a unipolar neuron rather than a multipolar neuron. A unipolar neuron is going to be the type of neuron that is only going to have one connection on the cell body. This is going to be the type of neuron that is responsible for simply sending or continuing to propagate information down large areas of the body because it's going to include a very large dendrite and a very large axon that are just simply going to be carrying information to and from other areas of the body. Another type of neuron class that we have is, of course, the bipolar neuron. A bipolar neuron is going to be the type of neuron that has one dendrite and one axon attaching to the cell body. And there's going to be two portions of attachment. So a unipolar neuron will have one portion of attachment. The bipolar will have two. And then the multipolar will have more than two, so three or more. And then, of course, we have our final class of neuron, which is going to be much more rare, and the functions are still, at this point, poorly understood, and it's going to be called the anaxonic neuron because there is actually no axon in those neurons, so there's no way to actually send information away in those types of situations. So those are going to be the ones that we see more in the special sense organs, and also in what we call the mirror neurons. That's also going to be where we see our anaxonic class of neurons. Next, let's talk about the neuroglial cells. Neuroglial cells are going to be different portions of cells within the nervous system that are going to have the primary responsibilities of providing support as well as helping to create new materials and act as the immune system for the central nervous system. The first ones we're going to talk about are the Schwann cells and the oligodendrocyte cells. Schwann cells and oligodendrocyte cells are similar in function in that they both produce a substance called myelin. Myelin is going to be spelled Lin. This is going to be a rather fat-rich substance that is going to cover all of the axons of our nervous system. And the purpose of the myelin, of course, is to provide a layer of protection to the axon as well as to help propagate or perpetuate the action potential as it goes down the axon. It's going to do this by helping to restore the action potential as it goes all the way down the axon, as well as speeding that process or that delivery up by quite a bit. Schwann cells and oligodendrocytes differ in their location. Oligodendrocytes are going to be the myelin-producing cells found in the central nervous system, whereas Schwann cells are going to be the myelin-producing cells found in the peripheral nervous system. Let's talk about the satellite cells and astrocytes next, because these are also going to be similar in their overall function. Satellite cells and astrocytes are going to be responsible for helping to provide a framework of support or a network of support in the nervous system, both in the central nervous system and in the periphery. So the difference between our satellite and astrocyte cells is going to be their location. Astrocytes are going to be found in the central nervous system, whereas satellite cells are going to be found in the peripheral nervous system. Now, a bonus function of the astrocytes in the central nervous system is that they are going to help create and maintain what is known as the blood-brain barrier. The blood-brain barrier is a very important and crucial structure for the central nervous system because this is going to be a layer of protection that helps to isolate the central nervous system from the rest of the body and help prevent various substances from getting in and wreaking havoc on those delicate nervous system cells. The significance of the blood-brain barrier is understated in many different aspects of medicine because this is going to be what allows us to actually introduce various types of treatments and medicines with the specific idea of affecting areas of the body that do not include the nervous system. So for instance, with something like an opioid medication to help reduce pain. So one of those medications, especially when it comes to reducing pain, it works by actually inhibiting the signals or the action potentials being transmitted by those nerves. And that's very good when we're talking about helping to tamp down pain signals being picked up by the peripheral nervous system, which is outside the blood-brain barrier. But if we're talking about a substance or a medicine that inhibits cellular activity, what if that medicine crossed into the central nervous system and started to inhibit brain function? That would be a bad day. So it's a good thing that we have the blood-brain barrier to work with because it allows us to design medicines that specifically do not cross over that blood-brain barrier and allows us to introduce those medicines that inhibit peripheral nervous transmission while leaving the central nervous system completely unfazed. Now, because of that blood-brain barrier, what's also going to be a consequence or a side effect is that the white blood cells of our immune system do not normally cross over that blood-brain barrier. And that poses a problem because now the central nervous system needs its own set of white blood cells or immune cells to help patrol the area and help fight off invading pathogens. So the central nervous system instead has microglial cells. Microglial cells are going to be the immune cells of the central nervous system. They live inside the blood-brain barrier and allow our brain and spinal cord to help fight off invading pathogens. Our final cell type of the neuroglial variety is to talk about the ependymal cells that we see right here. Ependymal cells are going to be the specialized cell which is responsible for secreting cerebrospinal fluid, or CSF for short. Now, cerebrospinal fluid is, as the name implies, going to be found within the cerebrum, another medical term for the brain, as well as the spinal cord. So we are talking about cells that live within the central nervous system only. They're going to be found within the ventricles, or the fluid-filled chambers filled with CSF within the brain, and inside the spinal cord, where we end up seeing our CSF flowing around the spinal cord as well. Now let's take a look at all of the individual portions of our neuron that we see right here, because just like all other cells, neurons have their own specialized divisions and specialized set of organelles that they use to actually function. We don't have to spend too much time covering this information because this is pretty similar to what we've been covering this entire semester here, how we end up having mitochondria, which are responsible for the creation of energy, which is crucial for neuron function because it requires quite a lot of energy to keep producing action potentials. We also have a nucleus and a nucleolus within the cell body. And then we're also going to see what we call the Nissl bodies. Nissl bodies are going to be clusters of the rough endoplasmic reticulums and free ribosomes that we see right here. Other terms that we're going to use specific to the nervous system are going to be the perikaryon, which is going to be our other term for describing the cell body. And then we have various neurofilaments within the cell body. These are going to be akin to the cytoskeleton that we see right here. When we break down the portions of the axon, we start with the axon hillock. This is the portion which attaches the cell body to the axon itself. It's also going to be the area where we see the beginning of a new action potential being generated to travel away from the cell body. And that's going to be an important distinction because when we talk about action potentials and which directions they travel, action potentials only travel in one direction. They go away from the cell body, down the axon. They're never going to go up the axon to the cell body. That's very important. Action potentials only travel in one direction. Now, as we make our way down the axon, we have another term to describe the cell membrane of the axon. It's going to be called our axolemma, and the substance that we find within the axon is also going to be called the axoplasm. Another term to keep in mind, one that I've already mentioned before, is the term axon terminals. These are going to be the areas where the axons break off here and creates the portions that lead down to the synapse. We've included this slide for you to have some practice with labeling all of the different portions of the neuron, so please make use of this. Again, this is a little bit of a review here based off of our discussion in the muscle unit. So when we talk about a typical synapse, we are talking about, of course, the connection or the site of communication between the end of the axon or the axon terminal and the receiving cell. So when it comes to synapses, we can have a couple of different types. We have synapses between neurons that we see right here. We have neuromuscular junctions between a neuron and a muscle cell. And then we have neuroglandular synapses between a neuron and a different type of gland cell, whether it is something like the parietal cells or the different types of glands that we find in the endocrine system as well. So we're going to see what we call a presynaptic neuron located before the synapse, and then a postsynaptic cell, or in this case for a synapse with another neuron, a postsynaptic neuron that we see right here. Just keep in mind we are talking about which one comes before the synaptic cleft and which one comes after the synaptic cleft. And then remember that we have neurotransmitters being sent across the synaptic cleft through vesicular transport to help initiate that intercellular communication. So here we have the visual representation of those different classes of neurons that I spoke about earlier, how we have the anaxonic neuron, is going to be ones without the axon. We have bipolar neurons that are going to have two sites of two sites of attachment to the cell body. We have one dendrite and one axon leading away. With the unipolar neuron, we of course have one site of attachment on the neuron. We have just this long axon that goes all the way past the unipolar neuron that we see right here. This is one that's going to be more responsible for just helping to propagate or helping to continue the communication in between all of the different sections of the nervous system, where we have dendrites up top receiving information and then sending it down an axon, where it is then restarted at the cell body and continues its way down the axon until its end target. And then we have our most common class, the multipolar class on the right. And then, of course, just to get into a little more detail about all of these supportive cells, the neuroglia, we've already covered these, how we have ependymal cells lining the ventricles producing CSF. We will find those in this cross-section of our spinal cord. We will find those lining the central canal, this tiny little dot inside the spinal cord. We have our microglia, of course, in the central nervous system because they live within the blood-brain barrier that we see right through here. And then there are the astrocytes as well that we see creating the framework of support throughout the nervous system, throughout the central nervous system specifically, because they are going to be responsible for maintaining the blood-brain barrier. And then we have the oligodendrocytes in the central nervous system, small cells that we find creating new myelin sheaths. On the topic of myelin, of course, this is going to be the substance that will help speed up nervous system transmission or speed up action potential transmission, because we're going to have these sheaths of myelin are going to exist in sections. They're going to have what are called internodes that we see right through here, and then nodes or nodes of Ranvier. I really like that name, nodes of Ranvier. It sounds so, pomp and circumstance, right? So the nodes of Ranvier are going to be the sections of exposed axolemma, which is going to be what allows an action potential to regenerate or restart as it makes its way down the axon, because as it goes down the axon, the action potential is actually going to lose its amplitude or lose its intensity. But when it comes up to each node of Ranvier, it can actually restart and regenerate that action potential, which is going to keep it traveling at a nice, strong, and fast pace. Now, this is also going to bring up the concept between white matter and gray matter. So, white matter and gray matter exist in the central nervous system, and they are going to be, as the name implies, colored either white or gray. White matter is going to be colored such because it is going to be heavy in myelinated axons, because only axons are myelinated. The cell bodies are not myelinated, which is why gray matter is going to carry its gray color, because it's going to be very dense in unmyelinated cell bodies. And of course, in the peripheral nervous system, we have the two neuroglia, our Schwann cells, which are going to function like the oligodendrocytes, but they will be attached to each of those sections of myelin instead. They're going to participate in the overall repair of damaged axons in the peripheral nervous system, which is going to be a process unique to the peripheral nervous system. We don't quite have this in the central nervous system. And then we have our satellite cells, which are going to function like the astrocytes and have their own function, a little bit like the microglia, where they will help regulate the environment and help to protect them from invading pathogens. When it comes to those Schwann cells in the peripheral nervous system, of course, they create myelin sheaths by way of surrounding the axons and starting to create this overall cover that we see right here. We have our Schwann cell nucleus is going to be seen right through here. Now, the outer surface of the Schwann cell is going to be called the neurolemma. So the exposed portion that we are actually looking at is going to be called the neurolemma. And when a Schwann cell begins to create a nervous system myelin sheath, it is going to do so by wrapping around the myelin or wrapping around the axon in a circular fashion. And as it rotates and wraps around and around, it's going to continue creating layer upon layer until we have this tightly packed membrane around the axon that we see right here. As far as the structure of unmyelinated axons go in the peripheral nervous system, we need to keep in mind that when we use the term unmyelinated axons, we are actually talking rather about the manner in which the Schwann cells are going to be wrapped around the axons. Because in a typical myelinated axon, we're going to see the axon found right in the center of the Schwann cell. But when it comes to the unmyelinated axons in the peripheral nervous system, instead we're going to see the axons exist adjacent to the Schwann cell rather than having that multiple layered wrap around the axon instead. This is going to allow for the axons to have a degree of protection and stabilization to them. But it does mean that without the typical way of myelination, the typical manner of myelination that we would normally see on myelinated axons, we are not going to see the nodes of Ranvier on our quote-unquote unmyelinated axons. And this means that the unmyelinated axons will transmit information much more slowly and a bit less efficiently than our myelinated axons. And this is going to be something that we're going to see more in the autonomic nervous system rather than the somatic nervous system, because the somatic nervous system needs to respond very quickly to different types of stimuli, whereas the autonomic system is going to respond a little more carefully and a bit more slowly as a result. Now, when it comes to nervous system repair, we do know that in the central nervous system, the reparation of damaged nerves is going to be quite limited and rather not quite present. We are going to rely on what is called neuroplasticity in the central nervous system for the resolution of symptoms or to regain lost function. But rather, with the peripheral nervous system, we're going to see the peripheral nerves actually have quite a good degree of self-reparation, and this is going to be because of the Schwann cells. So when we're talking about the peripheral nervous system, when we have a site of axonal injury, we are going to end up seeing what we call Wallerian degeneration. And Wallerian degeneration is a concept which states that when we have an injury to an axon and to the Schwann cells and myelin sheathing, we are first going to see the distal side of the injury begin to degrade or degenerate. But during the healing process, we are going to end up seeing our macrophages will invade that area and help remove any kind of old debris, whether it is going to be old damaged cellular material or any kind of invading pathogens as the result of the injury. We're going to end up seeing the macrophages of the immune system patrol this area and help clean everything up. And we're going to start seeing our new Schwann cells begin to proliferate along where the old axon was existing. And as they begin to proliferate, they're going to create this very favorable environment for the axon to begin to regrow into its original path. And as the axon grows into its original path, we are then going to see the Schwann cells begin to remyelinate or start to circle around that axon once again until we see our typical axonal regeneration. Now, when it comes to injury in the central nervous system, like I mentioned previously, the regeneration in the central nervous system is going to be quite limited. Instead, we're going to end up seeing some of the neuroglial cells actually help to or actually work against some of this regenerative process, especially when it comes to the astrocytes. So, when it comes to the overall treatment of injury in the central nervous system, we're going to use, and this is something that I deal with quite a lot in clinical practice as a functional neurologist, is we're going to utilize a concept called neuroplasticity. Neuroplasticity is a concept that the brain is actually very moldable and it can create new pathways, new synapses, new axons, and new dendrites to help regain all of the function that was lost as a result of injury to those old nervous system cells. And this is going to be something that is quite fascinating. And if you are ever interested, I would highly recommend taking a look at it. You can go ahead and go to the NCBI website, the National Center of Biotechnology Information, and you can go ahead and look up functional neurology and take a look at some of the different studies as a result. It's really, really impressive and really wonderful to see some of the progress that can be made. Everything from regaining the ability to walk when it was originally thought that that was going to be completely uh, impossible for some of these patients. It really, really is fascinating, and I highly recommend taking a look into it. Next, let's cover neuron physiology and the generation of action potentials. That's going to be our electrochemical signals, our action potentials. It can also be called saltatory conduction. So keep in mind when we covered the muscle unit, we talked about the generation of action potentials in muscle fibers at the neuromuscular junction. And we're going to see quite a lot of the same steps being played out when it comes to generating action potentials in the nervous system. Just keep in mind a couple of key differences. First of all, the neurons are going to maintain a slightly different resting membrane potential, negative 70 millivolts in the case of neurons. We're also going to see two different types of activations or action potentials. We have our general action potentials, and then we have what are called graded potentials. Graded potentials are going to be smaller activations of the neuron, which are going to be slightly decreased the further away from the site of activation you go on the neuron. So that's why we're going to call them graded potentials as opposed to an action potential. One other thing to keep in mind when it comes to the generation of an action potential is that they follow what is called the all or nothing theory. The all or nothing theory states that when it comes to generating an action potential, we either activate it full on, we go full send, or we do not have the necessary energy to activate an action potential whatsoever. We are not going to see just sort of action potentials being generated and traveling down the axons. We are going to see it all generated and traveling down the axon or nothing. And here is a great picture representation of the difference between our different types of action potentials. We end up having a resting potential, which is going to be carried in through the dendrites of the receiving cell to create a graded potential in the axon hillock, which will then create the full-on all or nothing action potential, which travels down the axon to its end target. And another review here about resting membrane potential, noting that resting membrane potential is made possible because of the high concentration of positively charged ions in the extracellular space outside the cell versus the negatively charged proteins which live inside the cell and contribute to that resting membrane potential, that difference of a negative charge inside the cell versus the positive charge outside the cell. The reason for the difference between graded potentials and action potentials are going to come by way of the type of channels that they use. Graded potentials are going to involve ligand-gated channels, where we are going to end up seeing neurotransmitters cross the synaptic cleft and bind to the ligand-gated channels, which will allow for the slight change of our resting membrane potential so that it reaches the threshold of negative 55 millivolts and then allows for the charge to continue down the surface of the nervous system cell membrane until it reaches the axon hillock. Once that charge reaches the axon hillock, it is going to activate what are known as the voltage-gated channels. The voltage-gated channels are going to allow for the transmission or the flow of different charged ions at a much more quick rate, or a much faster rate than the ligand-gated channels. And this is going to initiate that all or nothing response at the axon hillock, which will send the saltatory conducted action potential down the length of the axon. Then we wrap up the action potential by way of arriving at the axon terminal, the very bulb at the end of each of those axons. And when this new action potential goes to the end of that axon terminal, we're going to end up seeing the release of calcium ions through vesicular transport. They're going to travel across the synaptic cleft and then bind to the new receptors on the postsynaptic neuron. Much like the way that we saw the muscular unit action potential generation look like on a graph, it is going to follow quite the same pattern when it comes to the nervous system, just using different charge levels. So of course we have a different resting membrane potential than our muscle fibers. The muscle fibers carry that approximate negative 85 millivolt resting potential instead. And so what we're going to see is that graded action potential begin to start to bring the charge of our cell into a more positive scenario until we start to see the full depolarization in the axon hillock and the creation of a new action potential. And then, of course, we are going to see all of those systems reverse as all of those voltage-gated ion channels close and allow for the cell to repolarize and prepare for the next action potential. So let's take a look at how this is going to appear differently in our unmyelinated axons versus our myelinated axons. So in our unmyelinated axons, remember the overall structure of how that looked in the peripheral nervous system versus the myelinated axons with the Schwann cells surrounding the axons in the peripheral nervous system. Of course, when it comes to the central nervous system, things are going to work slightly differently. But when we talk about unmyelinated action potential generation, we are talking about a term called continuous propagation. And this is because when it comes to the generation of this action potential as it goes down the axon, we are going to see this generation happen again and again and again in much smaller segments that we see right here. So you see that we have this cut right here where we have the initial segment, segment 2, and segment 3, which is only up to right about here on the axon. We're going to see about the same amount of time being used to generate this action potential through all three segments. Whereas when it comes to a myelinated axon, let's go ahead and take a look at our cut that we see right here. We have the initial segment, our node of Ranvier 1 and our node of Ranvier 2. This is going to involve our saltatory conduction of action potentials because we see the regeneration of that action potential in between each of those internodes at the nodes of Ranvier, which means that in the same amount of time that an unmyelinated axon will send an action potential approximately 1/5 of the way down the axon, our myelinated axon will send that same signal in the same amount of time in down about half of the axon in the same amount of time. So much more quickly when it comes to myelinated axons. Look in closer detail at the synapse. So when we talk about the transmission of action potentials, we do need to talk about neurotransmitters. So here we have our artist's representation of the synapse. We have the axon terminal that we see right here, full of all of our neurotransmitters, and then we have our synaptic cleft and the postsynaptic target, whether it is another neuron, another gland, or the neuromuscular junction. In this scenario, we are most likely looking at a neuromuscular junction because we are talking about the neurotransmitter acetylcholine. Acetylcholine is going to be what is found at a cholinergic synapse. Cholinergic synapses are the ones most commonly used by the somatic nervous system. So our skeletal muscle nervous system is most common for the use of cholinergic synapses. Whereas when it comes to the autonomic nervous system, we are more commonly going to see neurotransmitters like adrenaline and noradrenaline, also known as epinephrine or norepinephrine. Now, I don't want to intimidate anyone from entering the neuroscience field, but the reality is that it is much more complex than the way that we teach it here in Anatomy and Physiology 1, because not all of the neurotransmitters and not all of the neurons that we're covering here are going to be excitatory. I mean, when it comes to acetylcholine or cholinergic receptors, those are almost always going to be excitatory neurons. But we do have a fair amount of nervous system activity, especially when it comes to regulatory neurons, that is going to be involved with the inhibition of synaptic activity or the inhibition of thoughts and actions, especially when it comes to the function of the cerebral cortex or the outer region of the brain, and particularly with the frontal lobes. The frontal lobes, one of the primary components or the primary functions of the frontal lobes is actually to be an inhibitor or to decrease the amount of thought or decrease the amount of action being generated by an area of the brain called the basal ganglia, which we will get into more in depth in a future chapter. But that's going to cover chapter 11 now, so everybody, please reach out to me if you have any other questions. I know neuroscience is a pretty complex topic, so I'm here if you need help. I will be back soon with Chapter 12 when we cover the spinal cord, spinal nerves, and spinal reflexes. Until then, have a great day.